Welcome to another easy nursing review. In this lesson, we will cover hypoparathyroidism. But before we begin, let's see if you can get this answer correct. A patient arrives at the urgent care center complaining of dry skin, weight increase, and cold sensitivity. The client may be experiencing the following symptoms, according to the nurse: A. Hypothyroidism. B. Hyperthyroidism. C. Hyperparathyroidism. D. Hypoparathyroidism. Comment what you think the answer is in the comments below. Now let's begin by first learning. What is hypoparathyroidism? The disruption of calcium metabolism caused by insufficient parathyroid hormone synthesis is known as hypoparathyroidism. This is because the parathyroid glands are not working as well, which results in low PTH levels and hypocalcemia. The autoimmune destruction of the glands is the main cause of hypoparathyroidism. As surgery now simply removes the dysfunctional gland, parathyroidectomy is no longer a prominent cause. Occasionally, the gland may be accidentally removed during thyroidectomy. Now, here are the signs and symptoms of the patient. The patient will present with tetany due to abnormal levels of calcium, tingling of periorbital area, hands and feet from abnormal calcium levels, lethargy due to low levels of parathyroid hormone, cataract development, convulsions due to acute low calcium levels. Overall, just remember that symptoms are due to deficiency of parathormone that results in an elevation of blood phosphate and decrease in blood calcium levels. Now let's go over important labs. Labs will reflect the following: decreased serum calcium due to low levels of PTH, increased serum phosphate due to low levels of PTH, decreased serum PTH from diminished secretion from the parathyroid glands, and decreased urinary calcium from diminished PTH. Diagnostic tests will include the following: positive Chvostek's sign due to decreased calcium levels and positive Trousseau's sign due to decreased calcium levels. You can learn more about these in our other videos. Okay, let's move on and learn about initiating treatments for hypoparathyroidism. Most important is to initiate a seizure precaution. Then, administer calcium gluconate by slow IV drip for acute hypocalcemia. Other treatments include the following: oral calcium, calcium gluconate, lactate, carbonate, large doses of vitamin D to help absorption of calcium, aluminum hydroxide gel to decrease phosphate levels, and keep a tracheostomy set and injectable calcium gluconate at bedside for impaired respiration from swelling, as well as for emergency administration of calcium. Great, now let's move on to nursing actions. The nursing actions include the following if the parathyroids were damaged during thyroid surgery. Interventions are to administer calcium to maintain the serum levels in a low normal range and inform the patient that testing should be done every 3 months. All right, well, you made it to the end of the video. Back to that question at the very beginning of the video. A patient arrives at the urgent care center complaining of dry skin, weight increase, and cold sensitivity. The client may be experiencing the following symptoms according to the nurse: A. Hypothyroidism, B. Hyperthyroidism, C. Hyperparathyroidism, D. Hypoparathyroidism, and the answer is A. Hypothyroidism symptoms include constipation, hair loss, dry skin, weight gain, sensitivity to cold, and decreased sweating. The indications and symptoms of parathyroid illness include calcium abnormalities brought on by either hypo or hypercalcemia. If you got it right, awesome. If not, that's okay, just keep studying. Bonus nursing tip. If you want to master hyperthyroidism, just remember that it is the complete opposite of hypothyroidism. So the signs and symptoms are opposite, and the cause of the disease is reverse. That's one less disease to study. Well, that ends this lesson. Click here for another nursing video.